Good evening, I'm Chris Hensing, and this is CBC Windsor News, our digital newscast, which you can watch on Facebook, Twitter, our cbc.ca/Windsor website, and our YouTube account as well. We're giving you the latest update on what's happening with COVID-19 and the news of the day here for our community. And we want to start here by letting you know that as of late this afternoon, there are no new confirmed cases of COVID-19 here in our community. But we can again confirm that we are aware of 3 confirmed positive cases, according to the Windsor and Essex County Health Unit. Now, at this morning's briefing, there was a big call from the Chief Medical Officer of Health to tighten the border restrictions. And that's because 2 of those confirmed cases that are in Windsor, Essex are of people who live here in our community but work in Michigan. Now, here's what he said. The U.S.-Canada border continues to be a concern for the residents of Windsor, Essex, and for the health unit as well. We're concerned about the travel to and from work in Michigan for our residents of Windsor, Essex. They may need to go to work, and we're asking for stronger measures. Now, we've reached out to the Minister of Public Safety, that's Bill Blair, who was the person speaking about those measures when they were put in place last Friday. We've not received a response, but we'll continue to update that story. A big part of that is because there's evidence of community spread of COVID-19 in Detroit, right across the border from us. They're dealing with more than 500 cases of positive results for COVID-19. The fear there is that what happens across the border could leak into what's happening here in Windsor, Essex. And that's why that call from the Windsor Essex Community of Health came out earlier this morning, asking for those tighter restrictions. Beyond that, we can say that there are 85 COVID-19 cases that are new in the province of Ontario, and the 8th death reported as this is now being called a critical week. Now, the most recent deaths include a woman in her 90s in the Durham region, and some breaking news this afternoon that an 80-year-old woman in Hamilton has died. Her death being, it's said that is related to COVID-19. This is just some of the stories that we're following here on our show, but tonight we're also doing something a little bit different. We're talking about the people who are helping each other and lending a hand to the community as all of this happens. In a bit, we're going to speak with Noah Campbell, who's going to update us on a hacking competition and how the tech community is trying to pivot from what's happening and what they wanted to do into what's going to happen next, and how some of the companies are helping each other. This is Facebook Live, so if you have any questions to ask him, feel free to leave those in our comments section. But right now I'm going to turn to CBC's Amy Dodge. She joins us now live via Skype. I'm just going to go pick up the phone here. Amy, thanks for joining us today. Again, we're in that position where we have some people working from home, and you're under that category today. But you were talking about some people who are trying to help out, specifically about hand sanitizer. What can you tell us?
Well, Chris, I'm going to talk first about Helena Rakadidis. Now, that is the CEO of a company called Interseasonings International. They make sauces, they make dressings within the region. People really know the company as being part of the Tunnel Barbecue.
Yeah. So
basically, they help to package the Tunnel Barbecue sauce. That's how we would know them. But we could know them differently very soon. So Helena had this idea. She had been seeing how other companies were using their infrastructure to make hand sanitizers. So she went home, she started emailing people in the community, whoever she could think of that thought maybe they would help her get this off the ground. What she got was an email chain that went out to 25 to 30 people and 5 companies who came on board in just a short period of time.
It's incredible to see that desire to help, people wanting to do something. But what are the next steps here? I can imagine that going from somebody who's a food producer to getting in the hand sanitizer industry isn't exactly an easy switch.
Yeah, she seemed very surprised by how different it was, although she was ready for whatever that would entail. She said there were a lot more regulations that she had to learn. There was more equipment, supplies, and the packaging obviously has to be different. There's different codes that would be involved as opposed to doing the sauces, which is something she understands. But what's really powerful about this story is the fact that she had these needs and people in the community rallied together to be a part of this. So Wolfhead Distillery, they came on board. Peak Processing, Essex Linen also got involved. And I spoke with a chemist from the University of Windsor who said, no, he's working from home. He has the knowledge in this area. He has a team of workers who he can utilize at the university. So the university is actually getting really involved in this as well. And Helena says, she started to realize that she no longer was the expert in this because of all of the resources she was given. So she said she started to actually take a bit of a back seat. She's stepped away a bit in this, and basically what that means is she realized her equipment at Interseasonings isn't probably what's necessary.
Okay.
So instead, the distillery and peak processing are stepping up. They're more likely to be doing the processing work. She's going to look at making sure they have she'll give supplies, she'll do the packaging, and kind of contribute in that way. So it's evolving, and she says, just like the coronavirus, it started as something that seemed very bad, but something really good is really coming out of this.
It's interesting to see how everybody's relying on each other, and that role is changing too. What someone thought they'd be able to do, now they're able to do something different. But you mentioned COVID-19 there. With all of this, you're taking a safety precaution right now, working from home. What are they doing to make sure that people are following those calls to social distance and to stay at home when possible?
So they're all in the same boat as us, Chris. They are working from home. So a lot of emails going around, a lot of use of technology like we're using now, making sure that they can connect with each other, share their knowledge of how they can get this off the ground. And what's also really interesting out of this conversation that I have, Paulina, is this isn't a short-term investment to them. I mean, we're now going to maybe see hand sanitizers being made right here in Windsor because they're looking at a long-term solution. They want to make sure that if anything like this happens in the future, Windsor is protected, that they also are committed to make sure that there's no longer a shortage. So they will start with distributing this to frontline workers, to the hospital, eventually then larger supplies to restaurants, and then they'll start working their way towards smaller packaging so that we can all have hand sanitizer on us in the future moving forward.
Wow. Yes. Pretty incredible look at what our community has been able to do here. Thanks for this, Amy.
You're welcome.
I'm just going to hang up on you, Amy. Nothing personal here, but I appreciate your time. Like I said, we've got Noah Campbell, who's going to be joining us later, and he'll be talking about some of the ways that businesses have been able to step up, if you will. We've heard from the Auto Parts Manufacturing Association talking about how manufacturers are trying to pivot away from what they might be doing or could have been doing before COVID-19 and into places where they're trying to create ventilators and they're trying to build respirators. Before that can happen, there's something called a bridge measure, and this is essentially where 3D printing will be able to step in. We'll ask Noah a little bit about that coming up here, but as we continue to talk about some of the examples of our community looking after each other, I want to direct you to the Grand Cantina. Chef John Alvarez joined me today on an Instagram Live, and we chatted about what life's been like for somebody who's in the restaurant business. Now, you can remember that there was that call to close restaurants unless there was a takeout option, so someone would be able to deliver or you'd be able to pick up. No dining room options available. When that happened, Alvarez had to make a decision whether to continue changing or to end it and say that it wasn't able to continue. What he's been able to do at the Grand Cantina is continue offering a menu that's available for people to buy and purchase fast food, or not fast food, but to purchase meals from. But what he's also been able to do, which is really interesting, is he's been able to, through food donated by people within our community and other chefs, him and his team, he's had to lay off about 20 people, but the ones who remain have been slicing and dicing and creating salads, as well as soup mixes and really these packages of fresh, healthy foods for families in our region. Now, he had about 40 cases of those as of this afternoon when I was chatting with him. That was available at the Grand Cantina, and he's encouraging anybody who might be able to make use of that to give him a call. He's also donated it to some food banks who we know are struggling at this time as well. But another example of how our community is relying on each other at a time when we're in a worldwide pandemic. The people that are needed most are our neighbors. We hear that again and again, and this is the latest example of that. Now, I'm just going to go over here where we have our Noah Campbell waiting. I'm going to pull up the phone here, and let's have a chat about what life's been like for him. Noah, I'm just going to pull you up. We're going to tilt you a little sideways there, get you full screen. Noah, just while I set up here, if you could just introduce yourself and what exactly is WinHacks?
For sure. Hi everyone, I'm Noah Campbell, a computer science student at the University of Windsor, and I'm the lead of WinHacks. WinHacks is the University of Windsor's first MLH-powered hackathon. So what's really cool about that is that MLH is a globally recognized consortium that really legitimizes hackathons. And originally what was going to happen with our event was that we were going to bring in people from across Canada, universities, our students from all these universities, colleges, high schools, and bring them to the University of Windsor to solve challenges in mobility. With the outbreak of COVID-19, we've reshifted to be Windsor's first fully digital hackathon, collaborating still with MLH, the Windsor Essex Economic Development Corporation, WECHU Alliance, and the University of Windsor to still solve the challenges we're having in mobility, but now also add a challenge and a layer to that to address COVID-19 and how we can help collect all this data that's being populated. We've got people across Windsor and Canada who want to contribute to supporting the effort to flatten the curve. So what we have to do is collate all that data, and our students are going to hopefully build a system that does that and shoot it off to the federal government, who will be able to grab the supplies that they need to build ventilators, respirators, masks, anything that is needed in the fight against COVID-19.
When we were talking earlier, Noah, you talked about how, there's sort of two sets of students that the public's been watching. We've been watching the ones who have had to have their classes canceled, but we've also seen the ones out on beaches partying and saying that, this isn't going to hit me. You seem to represent the crew that is trying to make a difference here.
For sure. I mean, these are not the students that are out in Florida, out in California, sitting on beaches and, not following those social distancing, social isolation guidelines by our government and neighboring governments. These students are future leaders in future of work companies. They're developers, they're managers, they're people that are working collaboratively, because we are the group that is going to have to absorb the economic consequences of this pandemic. So we are starting before this pandemic ends. We are starting now to help fix what is going to happen. We've got a lot coming. We've got a lot that's going to happen from this. So our students are working now to find innovative ways to bring back some of this economic fallout that we're going to see.
A lot of talk about the work that's happening here, but there's also some challenges as well. The University of Windsor has announced that they've had to postpone the convocation ceremony. How has this affected you as a student who's in our community and the people around you?
For sure. I mean, when the news came out today, it's obviously a very necessary decision to keep our students and our families safe from our chancellor. That was a very needed decision, and nobody's questioning that. But regardless, it's still really, it really hurts for our students who are graduating this semester, and we're hoping to walk the stage in May. It's a morale, it's a hit to morale. But what we're hoping to be able to do is use WinHacks as a way to give a distraction, but still a very necessary way to channel our students' frustration and everything they want to do to help flatten the curve. We're going to channel that in a very productive way and keep moving forward, and hopefully be able to create a method so good that we flatten the curve so well that this is eradicated as soon as possible, and we're walking the stage together again in the fall.
Wow, that's not a bad way to look at things. I know that people have talked about how this could be weeks, this could be months, but what we're seeing is urgent action from our tech community now. I've been on the phone with a few people who run 3D printing companies or have 3D printers available to them. Can you walk us through what's happening here exactly? So how can we possibly be in a position where we could print out supplies for people on the front lines?
We have the technology. And that's what's really important. The technology behind all of this is what's key, and that's what's moving us forward. So a lot of our companies locally here in Windsor have 3D printing workshops, have some 3D printing labs, and have been able to pivot into printing face shields and helping with that effort. I know Kelcom, who is a sponsor of WinHacks, has been able to print actual face shields to protect our healthcare workers, our frontline workers. Pepco is a company at the University of Windsor's Epicenter, which is our on-campus incubator, and they're being called in to help with ventilators and as well as face masks. So we're seeing students collaborate. As Amy had just mentioned, John Trant's group from the University of Windsor's Department of Chemistry and Biochemistry are also bringing in himself and his students to help other companies retool using the technology they already have and do what they need to do to address this pandemic, which is, hand sanitizer from what originally was producing alcohol. So we've got some great collaborations coming, and our students are driving this innovation along with our faculty and along with the community that we really cultivated with this.
I know we've talked a lot about what's being done from a student perspective here, and this show tonight has essentially been one of sort of some of the good news that's happening in our community. Yeah. Has there been a moment over the last couple of weeks that stands out for you as something where you've seen the Windsor Essex, the good side, the beautiful side of our community during all of this?
We're seeing it every day. We're seeing it when we're reaching out to organizations like APMA. They're going to be working with their partners in Windsor and abroad to bring together these supplies that are needed. We're seeing our students be really resilient and really adapt to change. Like, this is a huge change, especially our international students who came here to be part of our community, and now they have to isolate along with all of us and shift to this online learning platform, both at the college and the university. And seeing the resilience of our community and our students has been the bright spot of everything, and our ability to connect with each other through tech and everything that we're doing.
It's a beautiful way to leave it. Thank you very much, Noah, for joining us today. I really do appreciate it.
Thank you.
Stay safe.
You too.
All right, just going to hang up on Noah there again. Nothing personal here. And pop over to the desk there. That's Noah Campbell again explaining some of what's going on here as our community tries to really help each other, look after each other at a time when everybody needs as much help as they can to continue pushing forward. Now, this show looks a little bit different. It continues to look a little bit different, and we are trying to get updates as far as what we're able to offer here. And we'll continue to post about that on our website, cbc.ca/Windsor, and our social media platforms as well. As I leave you here, again, if you have any questions or comments or anything that we've missed, feel free. I've got my phone right here in front of me, and I'm reading the comments with everybody else as far as what's happening or what people are trying to understand. I do want to mention that our CBC morning show, Windsor Morning, continues to have updates every single morning, including from Windsor's Mayor, Drew Dilkins. And there is a push from the mayor to push back some of the taxes that people would have required to have been paid. And they're talking about that through council meetings. And there was a council meeting that just recently wrapped up, which is allowing councillors to vote electronically. Now, this is all stuff that's changing rapidly and something that we're keeping an eye on because people are wondering how these decisions are being made. And we want to make sure that people are being informed about what's happening. And the best way to do that, again, cbc.ca/Windsor and our Windsor Morning Show as well. As far as the other information that people need to know, right here is the list from Ontario of essential workplaces that can remain open. It talks about retail and wholesaling, food services, accommodations. This is all on our website as well, and I know that's going to have a trickle effect across our community as people try to deal with what's going on. Interesting to note, something that people have asked about here, telecommunications remains open. I know that that's something that we have a lot of in our community, and it's a story that we've been looking at as well to figure out what happens next. Another discussion that's been happening here locally is the idea of frontline healthcare workers who are crossing into Canada from the United States. They might work both ways, right? There's also that idea of the people who are coming back from vacations and working at our regional hospitals, including Windsor Regional Hospital. We had an update on this yesterday from Jason, but it's been something that's come up a couple times in the comments section here. So I just want to make sure there is an allowance here or an exception that has been made for about 30 people working at our Windsor Regional Hospital who have no symptoms, have been traveling internationally within the last 14 days, but are working in either the ER or critical care. Now, those are cases that need to be exempt from that call to self-isolate and not return to work after international travel. And that's coming from the medical officer of health. The Windsor Regional Hospital's president and our medical officer of health are working together to make sure that those cases are being treated properly and treated timely, or making sure that those people are reacting in a timely fashion. We have heard about that pressure that's been placed on our community for personal protection equipment as well, the call out for people to donate and to give whatever they can. As far as what people are needing on the front lines, it's masks, it's respirators, and we hear a lot about that N95 mask. And I just want to leave you with this story here. Last week, I went to give blood to see what that system was like, the precautions that were put in place. And there's a number of screening measures that are there to make sure that people who may have COVID-19 symptoms are screened out of giving blood or donating blood locally. But while I was there, there was a man who walked in he had construction gear on, he had dirty pants, and he had a look on his face like he wanted to help, and he had a box in his hand. And inside that box, in this one man's hand, was one N95 mask. And he brought it to the clinic and he said, "Do you think you guys would use it?" The clinic didn't need it. They said, bring it to the Windsor Regional Hospital, bring it there and see if that's something that they needed. And I talked to him for a bit and he said, yeah, that's what he was gonna do. His name's Chris as well. And so just to see how one man with one mask took the moment that he had in his day to try and help, it was pretty inspiring. And to hear that they also might need it shows how much help that our frontline staff may need at this time. And so I just want to leave you with that story of one man trying to do what he can in his small way as we sort of reflect tonight on the show about what our community is doing for each other at a time when we're all dealing with this pandemic that is hitting very close to home. That's it for our show tonight. Thanks again for watching. I remind you, cbc.ca/Windsor for the latest information. Our Windsor Morning Show continues tomorrow morning. Our Instagram account, if you search for CBC Windsor, you'll find that chat that me and John Alvarez had about how the restaurant he runs is dealing with this crisis and what they're offering to families who might need a little bit of help at a time when we're all looking to try to find a way to lean on each other. Thanks for watching.